Gestational diabetes. Welcome to our educational video on gestational diabetes. In this video, we'll be discussing what gestational diabetes is, its risk factors, screening and diagnosis, treatments, and risks to both the mother and the newborn. First, let's define gestational diabetes. Gestational diabetes is a type of diabetes that occurs during pregnancy. It affects around 10% of pregnant women in the United States and can cause complications for both the mother and the baby. One of the biggest risk factors for gestational diabetes is being overweight or obese before becoming pregnant. Other risk factors include having a family history of diabetes, having had gestational diabetes in a previous pregnancy, being over the age of 25, and being of certain ethnicities, such as Hispanic, African American, Native American, or Asian. Screening and diagnosis for gestational diabetes typically involves a glucose challenge test, where you drink a sugary drink and then have your blood sugar tested 1 hour later. If your blood sugar is high, you may need to have a follow-up glucose tolerance test, which involves fasting overnight and then having your blood sugar tested before and after drinking a sugary drink. If you are diagnosed with gestational diabetes, it's important to manage your blood sugar levels to prevent complications. This can involve making dietary changes, such as avoiding sugary and high-carbohydrate foods, and increasing your intake of vegetables, lean protein, and healthy fats. Regular exercise can also help to manage blood sugar levels. In some cases, medication, such as insulin, may be necessary to manage blood sugar levels. Your doctor will work with you to develop a treatment plan that is tailored to your individual needs. Finally, let's talk about the risks of gestational diabetes to both the mother and the baby. Uncontrolled gestational diabetes can cause complications such as preeclampsia, preterm labor, and cesarean delivery. It can also lead to high birth weight, respiratory distress, and low blood sugar in the newborn. However, with proper management and treatment, the risks of complications can be minimized, and most women with gestational diabetes go on to have healthy pregnancies and healthy babies. Thank you for watching our educational video on gestational diabetes. Remember to talk to your doctor if you have any concerns or questions about your pregnancy.